1. Drug resistance, a dent in the anti-malaria armor. GS Paper 2, Issues relating to development and management of social sector, services relating to health, education, human resources. What is the issue is about? The emergence of resistance to the artemisinin drug, a potent anti-malarial medicine, now threatens to affect the big gains achieved in recent years in reducing the global burden of malaria. This resistance to artemisinin becomes all the more dangerous as it has been the backbone of combination therapy for more than 10 years. Artemisinin is being used to treat malaria caused by Plasmodium falciparum, a protozoan parasite and one of the species of Plasmodium that causes malaria in humans. How did this resistance to artemisinin develop? It was only in December 2013 that researchers could conclusively prove that resistance to this powerful drug was due to mutations seen in the malaria parasite. Mutations in specific regions of the parasite's Kelch gene on chromosome 13, K13, was found to confer resistance to artemisinin. On the flip side, with K13 mutations serving as a marker for artemisinin resistance, the spread of artemisinin resistance across the world could be mapped. Is the resistance developed globally? The K13 mutations are still restricted to Southeast Asia and China with no immediate threat to artemisinin efficacy in most countries where malaria is endemic. The prevalence of K13 mutations in Southeast Asia and China is high, from 30–60% to close to 100%. Should India be worried? While no sample was collected from India, those from Bangladesh did not show K13 mutations. The containment strategy deployed has possibly been effective in limiting the spread. But the risk of the resistant parasites spreading to other countries is high due to intensive human population movement. It is particularly important that the highly malaria-endemic region of Africa is free of artemisinin-resistant malaria. Otherwise, it will lead to a global health crisis. What is drug resistance? Antimicrobial resistance is the ability of microbes, such as bacteria, viruses, parasites, or fungi, to grow in the presence of a chemical, drug, that would normally kill it or limit its growth. Causes of antimicrobial resistance. Biological causes. Mutation. When microbes replicate themselves, genetic mutations can occur. Sometimes, these mutations can lead to the creation of a microbe with genes that aid it in surviving exposure to antimicrobial agents. Selective pressure. Microbes that carry resistance genes survive to replicate themselves. The progeny of these resistant microbes will eventually become the dominant type. Gene transfer. Microbes can also acquire genes from other microbes. Genes that have drug-resistant qualities are easily transferred between microbes easily. Societal causes. Inadequate diagnostics. Sometimes, a doctor will diagnose an infection without all the necessary information. This can lead to antimicrobials being prescribed just in case, or broad-spectrum antimicrobials being prescribed when a specific drug would be more apt. Both occasions accelerate AMR. Inappropriate use. If a course of antimicrobial drugs is not fully completed, then some microbes may survive and develop resistance to the drug. If drugs are used for conditions they cannot treat, then microbes can also develop resistance. Agricultural use. It is thought that more antibiotics are used in animal agriculture than for human diseases. The use of antibiotics in farm animals can promote drug resistance, and drug-resistant bacteria may be found on meat and in food crops exposed to fertilizer or water that is contaminated with animal feces, providing a route for animal to human transmission. Hospital use. Critically ill patients are often given much higher doses of antimicrobials. The combination of more frequent utilization and close contact among sick patients creates an environment that is ideal for the spread of AMR germs.